It's that time of year when lots of us head out for a winter getaway. But how can we ensure that we stay safe and healthy while we're traveling? Here were some extremely useful tips.
There are some general considerations. First and foremost, one should stay away from any foods that are uncooked, any foods that one has not peeled themselves. You should stay away from unchlorinated tap water or unbottled beverages or beverages that have not been brought to a boil. They should avoid ice cubes from tap water. You should not eat or taste street vendor foods. A general motto is boil it, peel it, cook it, or forget it.
Boil it, peel it, cook it, or forget it.
Exactly.
And of course, if you're going to eat fruit, if you're going to wash it in their water, it's just as bad.
Exactly.
All right.
We all do certain things before we travel overseas. Make sure we have a passport, buy plane tickets, and make hotel reservations. But few of us give enough thought to our health needs while we're out of the country. Here with information that makes the difference between a glorious getaway and a horrendous holiday is travel medicine specialist Dr. Louis Morledge. Hi, doctor.
How are you today, Deborah?
Doing fine.
There are crucial things you should do before you travel to any exotic locale or even domestically. First and foremost, you should speak to your primary care practitioner or possibly even a travel medical specialist before you travel in order to find out what simple things you should do. For example, should you have any travel vaccinations, such as hepatitis A or yellow fever, depending on where you're traveling to? Should you be taking malaria tablets? These are some simple things you should do before you travel. The important illnesses to be aware of, first and foremost, is malaria, which is one of the most common worldwide illnesses. And that's something that is certainly prevalent in Africa and also in Southeast Asia. And travelers certainly need to protect themselves before they go away.
Okay.
Some of the basic things that an individual can do to prevent travelers' diarrhea is remember a simple rule of thumb. Boil it, peel it, cook it, or forget it. And that means drinking beverages that are bottled and that you know that have been bottled, that are sealed and are marked appropriately, preferably even carbonated beverages.
Joint pains, significant amount of malaise that really takes them down for the count. These are not fevers that someone can go to work with necessarily. They're fevers that would really impact someone's productivity significantly. Someone who has a temperature of 102 degrees is going to feel like hell. I'm hoping there are other things down the pike that might make it easier and might be more appropriate for treatment.